Hello everyone. I thank Dr. Charles for inviting me to participate in this ASB session. For this ASB grant challenges in upper limb biomechanics, I chose to talk about hand biomechanics and orthopedic translation. This is a topic aligned with what we do. My name is Zong-Ming from Cleveland Clinic, where I direct the hand research laboratory. The hand is vulnerable to many orthopedic and neurological disorders, offering many opportunities for biomechanics translation. We have taken a disease-centered approach focusing on carpal tunnel syndrome in two areas, carpal tunnel mechanics and hand sensory motor function. Just for the carpal tunnel, there are many biomechanics aspects involving ligament, tendons, bones, nerves, and so on. Let me show you our studies on the transverse carpal ligament. We know that the ligament has many important biomechanic and physiological functions. It acts as a pulley for the flexor tendons, anchors the thelar and hypothelar muscles, stabilizes the bony structure, and provides wrist proprioception. This ligament is a target for routine surgical release to treat carpal tunnel syndrome. The surgery has existed for almost a century without fundamental changes. We ask the question, can we treat the problems without cutting the ligament? A more specific question, can we expand the carpal tunnel by stretching the ligament? For example, balloon carpal tunneloplasty is used in hand surgery to stretch the TCL. We did a cadaveric study to investigate stretchability of the ligament. We found that TCL is not practically stretchable. Interestingly, we found that the tunnel area increased by shortening of arch width. This idea is illustrated by the simulation, showing the shortening of the arch width and arch formation. As the arch width shortens, the area increases dramatically. This means that we can compress the tunnel to gain area increase, achieving treatment effect. This simulation outcome is nice. Does it work in real hand? We are doing two in vivo experiments. Compression force is applied to the wrist. Tunnel morphology is monitored by ultrasound. Tunnel pressure is monitored by transducer. We have found that wrist compression led to formation of carpal arch, migration of median nerve, decrease of nerve flattening, decrease of tunnel pressure, which suggests the median nerve is relieved. Let's revisit the idea of ligament stretching. Assuming that the ligament is stretchable, just consider theoretically. How would the tunnel area be sensitive to ligament elongation? This simulation shows TCL elongation and area increase. Small TCL elongation also leads to large area increase. The question then is, how can we make it stretchable? One idea is collagenol lysis, enzymatic degradation. We took TCL and divided it into multiple strips, then submerged them in collagenous solution. The samples were tested at different time points to show tissue degradation and decrease in mechanical properties. We also did an in situ collagenous injection in cadaveric hands. The ligament was dissected out for histological examination, showing here the fiber breakage, dissolution, and the irregular alignment. Driven by carpal tunnel syndrome, we have performed many biomechanics studies of the carpal tunnel and the transverse carpal ligament, including morphology, fiber composition and orientation, imaging analysis, mechanical properties, and computational modeling. These studies help us improve clinical management of carpal tunnel syndrome, as well as other wrist problems. This is just one example of biomechanics research centered around carpal tunnel syndrome there are many opportunities for hand biomechanics and clinical applications. For biomechanics translation to surgery, I invite my collaborator, Dr. Seitz, to share his view of biomechanics from a surgeon's perspective. Dr. Seitz, what are some challenging clinical conditions you deal with whose management has been improved through collaboration with engineer colleagues?
Well, there are many. Everything from bony to soft tissue, fractures and dislocations in the hand and wrist, arthritic conditions in the hand and wrist, nerve compression syndromes such as carpal tunnel syndrome, different forms of tendon or ligamentous injuries.
How do you think hand biomechanics help contributing to solving those conditions?
Understanding the biomechanics of the pathology that we have in this very intricate machine we call the hand and wrist is the first step in really knowing how to treat the pathology. And working with engineers in the biomechanics field have helped us understand the normal kinematics of the small joints of the hand and wrist, as well as understanding how to correct their pathology by means of fixation, replacement, augmentation, and soft tissue reconstruction.
What do you advise for engineer-clinician partnership working together to enhance workflow for the translation of biomechanics research to benefit patients?
There's such a great opportunity for clinicians and engineers to learn from each other, but they have to engage. They have to be able to have the conversation on a regular basis as to what each of us is focusing on. Engineers need to know what I am frustrated with, what conditions are existing in the hand and wrist that are still unsolved, and help me come up with solutions for those problems. Conversely, engineers, if they're working in their laboratory, will benefit from this discussion because we'll have the ability to interact in a way that they can understand the clinical side of things and apply it to the research side of things.
From Dr. Seitz's view, hand biomechanics is needed to advance hand surgery. At this year's ISB meeting, Dr. An was recognized by the Maybridge Award. In his lecture, Dr. An illustrated with many examples that biomechanics research of the upper limb has fruitfully impacted orthopedic practices. More exciting news for us biomechanists. American Society of Mechanical Engineers recently established Savio L. Y. Wu Translational Biomechanics Medal in honor of Dr. Wu for his biomechanics research and clinical impact. This is really inspiring for biomechanics researchers. Clearly, biomechanics is well recognized in science, engineering, and medicine. This picture is from the Yangtze River in my hometown in China. The bridge makes a difference, connecting people from both sides for new opportunities. Biomechanics is like one of those bridges, overcoming the valley of death. Biomechanics is rooted in both basic and clinical sciences. Biomechanics is well positioned to contribute to translational medicine. Now, what is the challenge? Clearly, the field of upper limb biomechanics has a lot of opportunities for clinical impact. In my opinion, the grand challenge remains asking the right biomechanics questions for clinical translation. I acknowledge our funding sources, lab members, and collaborators. Thank you very much. Please feel free to be in touch with me. You all enjoy the discussion. Enjoy the meeting.